I'm 68 years old, and I was diagnosed with Alzheimer's disease in 2023. I'm overwhelmed that I can say 2 years after a diagnosis with Alzheimer's, my brain is better than it was 2 years ago.
In our clinic here at Ochsner, we have a relatively novel mechanism in order to expedite a patient's evaluation. First off, we'll have a patient be seen by our APP, an advanced practice provider, who's able to do a thorough assessment using what's called a Vanguard appointment, a virtual appointment where we gather information, expectations, in order to some cutting-edge biomarkers or blood-based tests that can assess for and screen for early signs of neurodegeneration, as well as getting the necessary brain scans requisite to make a diagnosis.
Think of me as a cognitive detective. If a neurologist is the mechanics of the brain, then a neuropsychometrist runs the diagnostic tests of the brain. I administer a standardized series of tests that focuses on a patient's memory, language, visual spatial skills, problem solving, and executive functioning.
In our clinic, we really try to focus on precision medicine. We look to the individual to figure out who they are at their baseline, their strengths from a child to adulthood, where they've traveled, what they've seen, and the person they've become as a consequence of that. And based upon the brain scans, the blood work, and all this information, we're able to come to a diagnosis. What's going on, what's causing these symptoms, and how we can best find a therapy to remedy it.
When people ask me, they'll relate what symptoms they have, and I say, well, it's not so much that you have certain symptoms, is it all the time? It's not just an occasional, I can't remember where I put my keys. But if it gets to the point it's bothering you and it's just all the time and people notice and it becomes a problem, then that's when you really start wondering, hey, what's going on here?
We're looking to integrate new transfusion therapies to help clear out the blood of inflammation and reduce the buildup of neurodegeneration. Biomarkers, or biological markers of disease, are different types of tests that we can do that can help us identify if there is a problem with the actual body. This can come in the form of looking for abnormal protein. This can come in the form of looking at a brain scan.
It was just devastating to try to process. I had no history. Not only did I have no family history of Alzheimer's, I had no experience of knowing anyone that has Alzheimer's. So it was just very difficult for quite some time. And then finding out that there was some hope, with the drug, and that there was something out there for a change that could make a difference, that was not just going to improve the side effects, that it could actually affect the pathology of the disease. That gave me comfort.
I envision Alzheimer's treatment evolving into a more holistic and proactive model. For example, disease anti-amyloid infusions can be complemented with personalized life and style interventions, such as brain-healthy nutrition, physical activity, stress management, and caregiver education, so that families and patients can work together to give a healthy lifestyle to our Alzheimer's patients.
I just can't believe it sometimes, that I can say I have Alzheimer's, but I am fine. I am not only fine, I'm better, I'm good. Everything's just improved, just everything. At the end of those 36 treatments is really mind-blowing.
I think one of the things that allows this program to grow as much as it has in the short time frame that it has is support by the community. Because we care for each other, we know if there's going to be a problem, we're the only ones that's going to fix it.
I don't know how much better the brain can continue to get, but I'm just ecstatic with the results I have. And I just want everyone to know that, there is hope, because there is hope.